Hi guys, it's Miss Medic here, and today's topic is acne vulgaris. Acne is extremely common and affects greater than 80% of teenagers. Males and females are equally affected, and the pathophysiology of acne vulgaris is due to a combination of different problems. There will be chronic inflammation of the pilosebaceous unit, and this is basically a hair follicle with a sebaceous unit attached. In acne, there will be increased sebum production, and there can be blockage of the pilosebaceous unit leading to comedones. These can be open or closed comedones, and these are colloquially known as black and white heads. P. acnes can colonize the blocked pilosebaceous unit. So what does acne look like? Well, I'm sure we're all familiar with the appearance of acne. It typically covers the face, neck, chest and back. And in acne there can be open comedones, blackheads, and closed comedones, whiteheads, papules and pustules, and nodules and cysts. And acne can also leave scars. Papules and pustules are often associated with the rupture of the wall of an open comedone, and nodulocystic acne is most commonly associated with scarring. When taking a history from someone who has acne, it is important to look for risk factors which may have caused acne, such as smoking, drugs such as steroids and anticonvulstants, and symptoms of a disorder known as polycystic ovarian disease. Acne vulgaris can be divided into mild, moderate, and severe. Mild acne is typically open and closed comedones with small pustules. Moderate acne is typically papulopustular, or mild acne that has not responded to treatment. Severe acne is nodulocystic acne, or moderate acne that has not responded to treatment, or acne that has significant psychological impact. The first line for mild acne is topical retinoids, or benzoyl peroxide. This is the first line treatment. This is topical and is applied over the area where acne is present. In moderate acne, oral antibiotics should be used. These are typically used up to 3 months, and the antibiotics of choice are tetracyclines. Minocycline is not used now due to the potential of irreversible skin pigmentation. If oral antibiotics are given for moderate acne, you should always co-prescribe a topical retinoid or benzoyl peroxide to reduce antibiotic resistance. Females can also be given an oral contraceptive pill for moderate acne. For severe acne, isoretinin is typically used, and this cannot be given to pregnant women, as it is dangerous to the fetus. Patients who are taking isoretinin or riracatin are not permitted to donate blood whilst on the drug, or for 1 month after taking it. This is because the donated blood may be used on pregnant women and would be dangerous for the fetus, as it can cause spontaneous miscarriage or severe birth defects. Isoretinoid or riracatin is highly effective in its treatment of acne. It has anti-inflammatory properties, it reduces sebum, and inhibits the growth of bacteria. Isoretinoid should not be taken with tetracyclines. This is because it will increase the risk of headaches and blurred vision and can lead to raised intracranial pressure. The side effects of riracatin are dose dependent but a common side effect is drying of the skin. Patients may complain of dry skin, dry lips, dry eyes, and this may be particularly problematic for contact lens wearers. It can even cause dry genitalia, which can lead to painful intercourse. As Ruracetin is very drying on the eye, ophthalmologists recommend that it is stopped 6 months before certain eye operations, like laser eye surgery. It is very important to know about upcoming surgeries in a patient starting on Ruracetin, and in 2011 a survey was conducted that found that 65% of dermatologists did not know if patients on Ruracetin had upcoming laser surgery. Ruracetin, or isotretinoin, will cause disturbed night vision and slow adaptation to the dark, and for this reason, pilots taking a course of Ruracetin must report that they are taking the drug to the National Aviation Authority. Depression is a rare side effect of Ruracetin, but can be very dangerous, so a careful history of any depression is required. Patients on Ruracetin can also get hepatitis, and alcohol should be avoided if on this drug. Thank you very much for listening to this video on acne. I hope you enjoyed it, and if you did, please don't forget to hit the like button and subscribe for more medical education videos.